Hello, my name is Ilie Ono. I'm a physical therapist and assistant teacher at University of Medicine and Pharmacy Grigore Popa from Iași. Today I'll present you a study about the advantages of simultaneous infrared light therapy and physiotherapy exercises in rehabilitation of post-traumatic hand. Post-traumatic hand rehabilitation is a priority for physiotherapists and medical doctors due to the complexity of the anatomical structures of the forearm, wrist, and fingers. The urgent need to use the hand by the patient stimulates us to find adequate recovery methods that shorten the recovery time. The most common hand injuries are fractures, radius fractures, followed by metacarpal bones and phalanx. Restoring the hand function involves increasing the mobility, the prehension, opposability of the fingers, and pluridigital grips and muscle strain. We propose a combination therapy. Pain and stiffness in passive and active mobilization is the main impediment in rehabilitation, limiting the patient's ability to sustain a fast and effective program of physiotherapy exercises. In classical physiotherapy, protocols do not include simultaneous forms of therapy, which could make it easier to perform the exercises, losing important time. A protocol of simultaneous exercise and infrared light therapy has been proposed to improve the post-traumatic hand recovery process. Objectives in hand rehabilitation: pain and stiffness reduction is a primary objective in active and passive mobilization. To restore the function of the hand, the prehension, opposability, and the fingers and pluridigital grips, bidigital and tridigital grips, was more important. The aim of the study was to quantify the level of the reduction of the pain and stiffness during physiotherapy sessions and after 30 days using combination therapy. In classical physiotherapy, protocols do not include forms of the simultaneous therapy, which could facilitate the exercise performance, losing important time in recovery. Materials and methods. The study was carried out on a 4 months period in Petra Neamț Micromedical Clinic on the group of 35 patients diagnosed and treated by the distal epiphyseal fracture of radius aged 43 to 62 years. The study aimed to assess the level of pain reduction as well the increase of the function of the head after the session of physical therapy. The patients were radiologically confirmed and they came on the physiotherapy quite quickly after the gypsum was removed by the orthopedist. For the evaluation of the functional test and goniometry, range of motion were used. For place assessment was used visual analog scale, and all the methods was made at and the assessments was made at the beginning and the end of physical therapy treatment. Patient underwent a physical therapy treatment complex consisting of TENS, ultrasound, infrared, passive and active exercise for 15 consecutive days, 3 weeks treatment. The experimental group consists of 20 patients treated with the combination therapy as a control group of the 14 patients treated without infrared therapy. Only physical therapy exercises were made. We have 2 groups. Experimental group have the schedule. Have a schedule. On the beginning, we have TENS for 20 minutes with 4-pole application, ultrasound 4 minutes with low power, 0.2 to 0.3 watts per centimeter square with a low duty cycle of 10%. We use a probe of 3.5 megahertz probe. In the experimental group, we have the combination therapy, physical therapy, passive and active exercises with infrared light therapy. The control group have the same TENS, same ultrasound, the same physical therapy exercises, but without infrared therapy. We have a specific protocol for combination therapy. We have two Philips bulbs, the source of light emitting. Exposure time was 50 minutes, face-to-face orientation bulbs. The protocol of physiotherapy was very easy. The patient hand was between the two light sources. The physiotherapist performed passive mobilization of the fingers and the wrist for up to 4 to 5 minutes. The patient performed for 10 minutes active mobilization at the command of the physiotherapist with previously demonstrated exercise. The patient knows all the exercises. This is the control diagram of infrared system therapy with a control unit with Arduino and display and temperature sensors. Now we will see a movie with some exercises, not all because we do not have sufficient time. We see the two bulbs, face-to-face orientation. The physical therapist made gentle and firm mobilizations of the thumb and the fingers on all the axes. We made flexion, extension, abduction, adduction, and circumduction. After that, the patient will make active mobilization exercises. The physical therapist gently move the fingers. We are interested about the pain of the patient and the pain level. We discuss with the patient about his pain and his stiffness. We moderate our exercises and mobilization with great concern about the pain. Now you see the mobilization of the wrist. We made flexion, extension. After that, we made radial and cubital deviation, and after that, circumduction. The patient fully cooperates, and the infrared light therapy was well tolerated, and they feel on pain relief. Now the patient make opposability. If the patient feel that the temperature is high, we make a rearrangement of the bulbs. We set up on a different position. We make the wide application. Yes, we use a softball, a towel, and other devices to make exercises. This is a short movie. We do not have sufficient time to make a 15-minute movie with physical therapy exercises. All the patients are quite well after the infrared and exercises. Results. The initial evaluation was followed by another one at the end of the 50-session treatment. The obtained results were analyzed in terms of two indicators: visual analog scale for pain intensity and functional tests for prehension, finger opposability, digital and trips grips, and muscle strength. After the completion of the 50-session treatment, the experimental group of patients show substantial clinical improvement, and they stop at the 50th session. The patient from the control group continued physiotherapy exercise for 3 to up to 5 days. after the end of the 50-day session because they still had to regain mobility, thus entering and the 40 week. It's a difference. The main result is the patient from experimental group with infrared therapy, they finish on 3 weeks treatment, but the patient from the control group, they need 3, 4, 5 days to make physical therapy exercises to regain mobility. That is the key point of this study. Another key point of this study is shortening the time of the treatment. In the left side, we have the visual analog scale for 15 days. For the control group and experimental group, both groups have significant improvements, but the experimental group was doing better. The value was, the median value was 1.5 VAS value. On the right side, we have the functional recovery time on the experimental group. The time was measured in weeks. And on the experimental group, we see 3 weeks treatment, and the control group, we see 4 weeks treatment. This is a key point of recovery. Infrared therapy with simultaneous exercise therapy, physical therapy exercise was well tolerated by the patient, and the patient was very glad and happy to make this combination of therapy. Thank you all for listening me. We have some conclusion to take of this study. This therapy shortened the work time, bringing benefits of the patient from the perspective of the pain and stiffness. That is a good thing. Following the analysis of the pain and function, we can say that the physical therapy exercise and simultaneous infrared therapy reduce the symptoms and improve the function of the head. We have some advantages for this combination therapy. Pain management without drugs, reduction of the local inflammation, reduction of the stiffness, good management of the rehabilitation program, reducing the recovery time, and the procedure is non-toxic and safe for the patient with low cost and versatile. It's all about the physical therapy process. Thank you, everybody, and have a good day.